I'm going to go through a few methods, an overall viewpoint, and then methods on how to do some needs finding. I have about 45 minutes, now a little less. So unfortunately, the depth is not going to be what I would ideally like to have. Ideally, it would be great if we could pick one little tiny spot and then workshop it, and then you go out and try it and come back. Maybe that's something we can do in the future. So without further ado, let me sort of start on some of these ideas. I will be up front that I used to be very much a design thinking advocate. And one of my heroes or passion people that I really wanted to work with was, one of the people that built some of the design thinking infrastructure way back when. And so I came to this space very much as advocating design and participatory design and action-oriented design. And unfortunately, I've had to change my perspective over time. So I'm going to do a shameless plug for those of you that are interested. The Praxis Institute is a sponsor of the Ideation Clinic. They have provided us with resources to help promote ideation around people living with spinal cord injuries. And as you're moving forward in this, I really welcome you to join up in the challenge. In addition to these huddles, which are sort of informational, we'll be running a series of facilitated ideation with workshopping these concepts to get you into a demo for their demo day, which then will award money and also expose you to investors and downstream partners for your innovations. So please go on our website, ideation.clinic, if you want to find out more and join. That we also, on the 27th, if any of you are students out there, we are going to be opening ideation fellowships for students valued at $7,500 each. So as you're part of the challenge, you will also receive a bit of a stipend to help you ideate. So my goal actually is 3 questions: what, why, and how. That's what I hope to cover in about 30 minutes or so. And if I'm successful, it should hopefully give you a bit of an understanding, very, very, very high level and very artificial, because honestly, these are the things you actually need to go in and do. You got to get your hands dirty in this stuff and actually be involved with people. So I'm going to give you a bit of a primer. I'm going to talk about the approach, and we're going to warm our brains up a little bit, and then we're going to talk about sort of the worksheet of how needs finding can be done. This is one approach. There may be others. Over the years that I've been doing this with students and people, this seems to be the most logical and sort of fruitful approach. So let's go back and what is a need? Does anyone want to jump in? Feel free to turn on your cameras or not, or your audio, and who knows, what's a need? Not a trick question, by the way. Yeah.
I would define a need as something that is very essential in order for survival or to meet a standard of living.
Okay. I need a drink of Pepsi. I need caffeine. Is that a need?
Those are wants.
Oh, okay. So let us get into some of the understanding. You're absolutely right. So there are different kinds of needs. So one of the really important things is, as you approach this, is to understand what's motivating you. It's one thing that I need some pop. It's another thing that I need open heart surgery. One is a luxury want, perhaps. The other is something that must happen if I'm to survive. How much am I willing to pay for a can of pop is very different than how much I'm willing to have the system pay for my open heart surgery. Okay, so the need and its priority matters. And just because there's a need doesn't mean it's a good need, or it doesn't mean that it's one that you should pursue to solve, because there may be no money in it, or it may be a lot of money for very little reward. So that is a balance that we need to think about as we approach needs. The most basic way that I've seen needs defined is that it's something that inspires action. And that's important because actions are drive behaviors. And behaviors are important because we're going to frame needs finding in both, hopefully, an economic perspective, but also a social good perspective, because you can't necessarily go after needs that have a very negative economic effect. It's just, unless you're incredible, unless you're Bill Gates and you can fund your own ideas, chances are there are compromises to be had. So when we're talking about needs, we're also going to be talking about how intense. Is it an essential need? Is it something that must happen? Because that is going to be a lot more motivating to a market where if everyone has to have this cancer drug to avoid relapse, and they have to have it every day, that's a much greater need, and you can charge more money for it, and there's more of a business case. At the same time, you're saving somebody's life. So what we're going to talk a little bit about is this mechanism, which comes from engineering. It's need gap analysis. How do you actually understand to build things and to do things? So the process is relatively simple, but it's not easy. So we'll talk a little bit more about this, but essentially the overarching summary is you're going to be looking at what's happening right now in the market, what's happening in the hospital, what's happening where you are. Where do you want to be? Improved health, improved care delivery, more efficiency, improved patient experience. What's stopping you? What are the barriers? What's causing those barriers? Is it cost? Is it a lack of technology? Is it a service that's missing? Is it a regulation? Is it reimbursement? What are the main problems that you're facing? Once you understand those problems and you have a strong unmet need that is not a want, that is not necessarily easily overcome by your competition, then how do you start conceptually prototyping and developing a device or an intervention that will get you to your desired state? All right. Why is this important? So I can give you a bunch of different reasons and give you a bunch of different arguments, but at the end of the day, it's this. If you're going to use the business model, and we're going to look at a business model, if you give a customer something they don't want or they don't need, you're going to have a much harder time selling it to them than if you ask the customer right away, what is your need? How can I satisfy that need? How much would you pay for that need? Oh, okay, now I understand you have this need and that you're willing to pay for it. Oh, by the way, as a customer, would you help me test and develop it? Oh, so now you have the customer not only telling you what the need is, but also how motivated they are to acquire it. And you now have the potential of converting your co-creator into an actual customer that pays for it. Oh, big company X, you have this need. Oh, if I can deliver this need, how much would you pay? $100 per unit? Oh, well, I'll give you a special deal. If I can deliver this in 2 years, let's sign a contract that you will get a special price of $65 per unit if you help me develop and make sure that it's to the specs that you want. How many businesses would say no to getting a product that meets their needs and meets their delivery at a cost they're comfortable with at a discounted price? So understanding the need is important, because not only is it winning over people that can be helpful in innovation, but it's developing your understanding of your market and who you're trying to help and how you're trying to help. So, are we good? Any questions? I really don't like just talking one way. 2 thumbs up. Anyone else? Any comments?
Quick question.
Great, thank you. Yes, go ahead.
So what happens when the buyer says, yes, I'm going to buy it, when you just have talking about the concept, but when the product is available, they don't want to buy it?
That's a great question. And quite honestly, that's the reality in Canada. If you go to almost any hospital and say, what's your need? They'll tell you. When you come back to them and say, hey, here it is, they'll say, oh, but our budget's changed. Oh, this has happened. You know, I have an acquaintance who's a surgeon who, during one of their first entrepreneurial experiences, decided to go to other surgeons with their idea. And all of the surgeons said, oh my God, that's so amazing. I can't wait till you make it. So he spent a lot of time making it, and he realized the idea. And then he went back to his group of friends and he said, hey, friends, here it is. Will you buy it now? And they said, well, it was a great idea, but I'm not in the market for it right now. It's okay, like, but it's just not the kind of money I want to spend, and couldn't sell it. And he learned something very important from it. Just because someone tells you they're going to buy something doesn't mean they will. If you want this kind of plan, so I was alluding to what's called value-based procurement. If you're going to go towards that kind of model, it's called lawyers and contracts. No handshakes. If I'm going to spend 2 years developing something for you, you are going to sign an upfront contract with my lawyers, not me, that you will actually buy if I deliver what you are telling me. So yeah, this is where I was accused last hour of being a little idealistic, and maybe that's true. But at the end of the day, I'm idealistic enough to know that I don't know everything, and lawyers will help with that particular problem. So do not, and this is also I experienced when I was much younger and I was running companies. It's usually the person that comes to you and says, I'm going to make you rich, just do this for me, that is the person you never ever want to do business with, because they are likely not the one that's going to sign the contract, and they are likely not going to be the one that pays you. Anyway, moving along. Any other question? Was that a good response? Satisfactory?
Yes, thank you.
Okay.
Sorry, Joseph, a quick comment here. I think Shahira and Goldie last week also has spoken about, how challenging it is to, to adopt medical technologies in Canada. Perhaps one key important point for innovators to realize in here is that you have to think beyond the Canadian market. If you're developing a new technology, a new innovation, if you are to establish a successful business that will actually drive revenue, Canada is a very small market compared to other jurisdictions like the US, for example. So it's almost always the case that you have to sell outside of Canada in order to have a kind of a sustainable business model there. So always keep that in mind. And I think we'll be talking more about this point specifically when we have the session on reimbursement as well.
However, and to add to the conversation, Canada actually is very unique in that it is a petri dish of pretty much a good selection of cultures, people, and genetics and diseases. So even if you need to sell your product elsewhere, because of the expertise we have, because of the research and facilities we have, and most importantly, because of the diversity of the people we have, Canada is actually arguably a very good place to innovate, even if you're going to export the innovation. So, there are advantages to being in Canada. The problem, I think, for Canadians is that people don't stay in Canada, and it's not sustainable if every time somebody who's really smart does something and then they leave. For us as a country, that's not an ideal business model. So, okay. Petri dish, we have the disease. Okay, moving on. Let's do a little bit of a warm-up. So, could somebody volunteer to read this for me? This is like participatory a little bit, sorry. Yes, Atia.
Sure. So in the study, 1,000 people were tested. Among the participants, there were 5 engineers and 995 lawyers. Jack is a randomly chosen participant of the study.
Okay.
Jack is 36 years old. He is not married and is somewhat introverted. He likes to spend his free time reading science fiction and writing computer programs.
Okay, everyone got that? Here's the challenge. Which is more likely? Jack is an engineer or Jack is a lawyer?
Lawyer.
Really? But he's introverted, not married.
Yeah, but there's only 0.5% of getting an engineer, according to the statistic.
So it's really important when we think about needs finding and problems and understandings that we also understand our own biases. Because, for example, if I were better at this, the PowerPoint thing, I would have made the first bit disappear and then given you more hoopla around the fact that Jack is introverted. And then had you answer. Because the bias is that if you're introverted and you like writing computer programs, you must be an engineer. Even though here, in this case, it's very unlikely. But we go out, we talk to people, and we make assumptions. And it's very important to understand your assumptions when you're going to approach needs. Okay, next problem. if it takes 5 minutes, or if it takes 5 machines 5 minutes to make 5 widgets, how long would it take 100 machines to make 100 widgets? Anyone? Anyone? Not supposed to be hard problems. Jump right in. How many? 5, not 100. It's easier to say 100 because we are, as human beings, pattern machines. We like to recognize patterns. We love patterns, even if they're not logical. Okay. A bat and ball cost $1.10 in total. The bat costs $1 more than the ball. How much does the ball cost? Anyone?
Cents.
Sorry?
5 cents.
Okay, we have too many smart people. You got it. But the assumption usually is, oh, it's 10 cents. So the purpose of those sort of little brain teasers is to actually make a little bit of a point, just to get you guys relaxed a little bit, but also to think about how we approach needs finding. And what I'll be talking about in the next sort of half hour is an approach that we've developed at the Ideation Clinic, and it's part of a bigger system. So we're going to be looking at a piece of it. So understand it's a little bit out of context, and it's only a piece of the big puzzle, and it's not necessarily going to be everything. So let's go back to where we were talking about innovation. So if we're talking about innovation as creating something that's new or better, one way to do needs finding is to start out with, okay, what is going on right now? So I go in and I look at a patient experience and everyone is complaining, oh my God, I'm not getting enough good, nutritious food in the hospital. It's all bland. Okay, that becomes what the current state is. Well, it seems that what ideally would be is you provide good food in the future. So now you have a potential innovation. You have a need for good, nutritious food in the hospital. Seems really easy. But all of a sudden, you encounter barriers, problems, and gaps. So part of this process that I'm describing is going out, understanding the space, your market, your client, your patient, your user, whatever word you associate with it, what you could do to improve their experience and why it's not being done. Why is the food bad? Why is the waiting list long? What are these barriers causing the need? So you're becoming a kind of service provider. You're identifying where in the market there's a problem, what the people want. Now, who the people are is a bigger conversation. It could be patients, it could be physicians, it could be government. You're looking at what's preventing them from getting what it is they want. And then you have to look at, how do I solve that gap or problem? So what's at the root cause? Is it a technology that's missing? Is it a product? As you understand what the problem is, you've now started identifying an unmet need. An unmet need, once you've identified, then will inform you how to start conceptualizing an intervention, something that might meet that need so that you could go towards your desired state, your innovation, your market-ready device. So how do we do this? Well, actually, it's, sorry?
Sorry, Jeff, we've got a question from Phoenix.
Go
The
ahead.
question, what if the barrier is a social construct or a political issue?
And that's fine too. So if it's a political issue, you're going to have to evaluate it. Can you provide a solution to that barrier? So if you remember back to the talk earlier, a billing code is essentially, if you think about it, a political barrier. So you're going to have to find a way around it. So finding your way around a political barrier, how do you do it? Change the billing codes. Go to somewhere else that has different billing codes. Find a new market. Abandon this need because you're not going to make money at it. So just because you find a need does not mean that you will have a successful business or an intervention or an innovation. That's just the beginning part. Once you have a strong need, you still have to figure out, can you solve it? Can you deliver a product or service that will meet the need of the market at a cost or a mechanism that's worth your while, that also satisfies your investors, that satisfies everyone else? But at the end of the day, if you are not improving the health or whatever it is that the people you're trying to help, if you're not making a difference for them, you're not actually necessarily going to sell a lot of your widget. Maybe at first. You know, the pet rock was an amazing example. 70s, all marketing. You know, it was great. It was a cultural phenomenon. But at the end of the day, people started figuring out they could go out and pick up a rock for free. So when you are starting to do needs analysis, or when you're starting to go into spaces to try and identify problems or gaps for you to solve, one thing you need to start thinking about is you start at the end. What is your purpose and priority? If your purpose and priority is to make money and make this a sustainable or profitable venture, and I'm not just meaning make oodles of unrealistic capital at the expense of people, I'm talking about being able to sustain delivery of something that helps people over time. So it has to have an economic perspective, even if it doesn't make the system a dollar and you just want to innovate for social innovation. You're still going to have to figure out, where does the resource, the economy come from? If it saves the system money in one area, you can fund other things in other areas. You still have to figure out what's your end game first. If your focus is to have a profitable company, your strategy is going to be very different than if you are a social entrepreneur. So know your end game. Realize your assumptions. You think you know what the client or the customer or the patient wants? Well, you don't. You're not the expert. They are. Go talk to them. Understand where you want to end up helps you define the pathway. That's why needs are so central. Knowing what the need is and the fact that you can address it gives you hints of what you may have to do in order to solve it. So if the problem is regulatory, you're not going to likely change the regulatory infrastructure. So how else can you deliver that? Okay. Now, the worksheet that you see before you is one that we've developed in the ideation clinic. And as you can see, we're actually going to be starting in one piece of it, and this is the needs analysis. It actually does very much follow what you heard earlier today from the guest speakers. First stage is identifying your strategy. Your strategy very much depends on where your outcomes are going. Second stage is exploring opportunities. This is tied into the needs analysis. And the third stage is selecting your approach. All of this is done before you start making your prototype, before you start making and investing real money into hardware and coding and whatever else there is, so that you understand what you will need to do and how much you're going to have to invest to make this real.
So Joseph, we've got a question from Alex Barnes, which is, who have you found to be the helpful allies? It's probably from the previous slide.
It depends on the context. The most helpful allies can be the people that are being impacted by what you're trying to solve. If I have a constant pain and you are going to solve that pain for me, I am going to do everything I can to help you. So patient groups, patient advocates, physicians who want to solve a problem they're seeing in a particular space are potentially your greatest allies. They may not be the ones that end up paying for this, but they may be the ones that end up using or prescribing or impacting. And they become both your advocates and your co-creators potentially. Involve the patient really early on is sort of the mantra. Okay, so really important when you're going to identify needs and going into a space. In our program in the TRP, we recommend you start with unlearn. And part of the exercise earlier was to make the point that we all have biases. We all have unconscious biases. And if you just go in and ask 10 of your friends who want to be nice to you, what they think is the most amazing product ever, they're going to tell you what they think you want to hear. Or when you go into a space and you know that the problem is X, you will pay attention to every single possible bit of evidence that X is the problem. It's called confirmation bias. So really, really important when you start looking for needs that you try and do so systematically in a methodological approach that allows you to judge those needs without imposing your own value systems. And that's impossible. So the best you can probably do is mitigate. The next thing you need to do is be able to observe. So quite often the starting point is, let's read the literature. Well, we know, and I've talked to some people quite recently about this, that about 18 to 20% of stuff in peer-reviewed journals can be replicated. What that means is that 80% is dubious and potentially wrong. Basing your opinion on the literature is basically saying, I'm going to trust that the wrong part, 80%, is going to be good enough to guide me. Statistically, not a great place to start. You have to go out and talk to the customer, talk to the people. You have to go in and actually do primary research to try and understand the space before you go to the literature so that they can tell you what they think the solution or the problem might be. Because the literature may not be as accurate or even if it was accurate when something was published 10 years ago, I hate to tell you this, but in the last 2 years, there have been a lot of changes to the way things are being done and to the way things people are thinking about things. If you were to go and do something based on literature that was published before 2018, I'm willing to bet there's probably a change. So direct observation. Then you can generate needs. It's a matter of a selection process that's standardized. This is where we'll talk about putting in other ideas and meshing them together. So the basic gist of what I'm proposing as an approach is you start by going to talk to people, by going into the space and observing and trying to understand what's going on and where are the gaps. But you do so first acknowledging that you're not the expert, that your biases are going to be red herrings that you need to get around. So this is where you need to be careful at how you learn and how you engage. Once you start observing, what you're essentially doing is you're asking questions, you're listening. These are sort of researcher skills, whether you are from marketing or from basic science. Being able to sort of observe, describe, and then test the hypothesis is what we're really talking about here. And again, contextual inquiry. Don't think that your brother-in-law has the solution because they say so. Go out and ask the people that you're trying to work with. What do they actually want? Selecting the issues, the needs, this is where, and we talked about earlier, the viability, feasibility, desirability, and some people add sustainability. These developing metrics by which you can judge needs is very important. And so, yeah, you can be agnostic to needs and go out, but you have to have a way of judging them. This is where the economics, the technology, the market size, all play a role in how you select the need you're going to work with. And what your interest is, your personal interest is also important. So I'm using a really quick sort of example from a group in one of my classes. They identified that in our healthcare system, there's a need for more efficient communication between primary providers and experts. So people are getting stuff, going to see specialists. Specialists are prescribing stuff, but nobody knows, your GP or your other doctor has no idea what's going on with your care. That is a system, that is a problem that I've witnessed myself. And that is a problem that costs the system millions and millions of dollars, because now you're seeing multiple specialists getting multiple treatments without anyone overseeing your care or the impact of a holistic care model.
So Joseph, we have a question from Samir Rator. What are your comments on market/competition-based approach of identifying a need? If there is a medical device getting approved by regulators for image-based analysis, then you can do it in a better way.
Okay, so is the question a market competition-based approach? Well, so if you're there, what do you mean by that? I mean, anyone? So knowing that there's something coming to market and you have an alternative, is that sort of what you're suggesting is the market-based?
Samir, do you want to chime in? Oh, you can't speak. Okay, got it. I take it, Samir, tell me if I'm understanding your question correctly. What you're asking is if there's a market-driven approach of identifying a need or competition-driven. And if that is impact, Samir, is that what you're referring to?
So
Great.
it seems that that is. I would caution you, as the others did in this place, before you go to researching the market and the competition, first make sure you have a good solid need, because that you are then jumping, as they said, to quote unquote solutions. If you go out and you start looking at what's already being provided, you don't really know where you want to be yet. So my point is this: if you look at the next couple of steps, hopefully it'll be a little more clear. If the problem is communication between physicians and specialists, and you do your analysis and you go and you talk to them, what's going on? Well, maybe it's the fact that they're using fax machines. Maybe it's the fact that on their forms there isn't a checkbox that tells their administrators to send the file back to the GP. Maybe it's because their information is stored on CDs and somebody else can't read the CD because their computers in their office have been upgraded and lack CD players or DVD players. So once you sort of understand what's causing that barrier, that question, the problem, then the next question becomes, well, how can you address it? So in this approach, you have a communication need. You know that what you're trying to do is improve the communication, but you can't go out yet into the market because that would assume that you're looking at a particular market. So in this, if the problem is, how do I solve the communication need? One way could be, when we start ideating, that you develop an app. Another way is that you could connect the brains of the experts and the GPs. You're not tied into a solution at this point. The danger of looking right away into the marketplace before you ideate is that it'll influence you to just do a Me Too business. If you're basing your business on really a solid need and problem, at this stage, when you build the requirements based on a need and the problems, you still are open to exploring different opportunities. Maybe you hire a runner. If this communication is the problem, maybe it's a $15 an hour intern that takes the notes from one part of the hospital to the other. I don't know. If you look at the nature of the need and the barriers to it, then you can start unpacking what could you do about it. So this schematic, which we could share, is basically an approach. So you start with, okay, do you have an idea of something you want to do? If you have that idea, then you have to go back. You have to talk to the people and verify the need. Make sure that you made the right assumptions, or that your assumptions are in track with your market, with the people you want to sell to, which then gets you back to talking to people, talking to your client, to your user, to the people that hold the purse strings, the decision makers, the stakeholders. If you don't have an idea, then you need to identify a need. You need to find a domain in which you want to work, possibly one you're interested in, maybe one that relates to your business already, or your friend group. And you still have to go back and do the primary research on who it is you're going to sell to and how. Once you've done your primary research, you build a list of all their gaps, their needs. They can be political, technological, social, many gaps of any nature. It doesn't really matter what they are. The question will become, can you solve them? How, and is it meeting your purpose? If it's to generate profit and be a viable business, then it doesn't matter at this stage what those needs are. Then, oh, sorry, that's a little out of order. The primary research is stuff like ethnography, direct observation, inquiry, surveys. So you understand the space. Then once you have that list, you prioritize it. And this is, you need to have standardized sort of metrics of how you're going to evaluate your ideas or the needs. Feasible. Can it be done? Is the technology out there or close to it? Do you have a secret sauce technology that might make it cheaper or better? Valuable. Is there value for you to do this, or are you just wasting your time? Like, are you going to get anything out of it? Are people going to get anything out of it? And who is going to get something out of it? Desirable. Do people want it? Do you want it? Does the system want it? And sustainable. Can it be kept up? So if your business plan is to get grant after grant after grant to keep redeveloping your prototype, you are going to fail, because eventually the grants will run out, and any investor smart enough to see the writing on the wall is going to see that you are not capable of moving into the market and actually getting revenue for your idea because you're chasing grants. Then you select whatever the strongest need is. In one case, I worked with some group of students at Medventions who came to me with, I think, over 45 needs they identified. And they, through a various selection process, they narrowed down to 15 and then 3. And then they got stuck and had to go back and iteratively reassess and get more advice and find out which is more profitable. And then once they did that and validated it with the physicians and the space, they were able to define a problem and move on to start ideating and start building on a prototype that would address that need. And that actually is the next part of the process, which is essentially the requirements and the building steps. This is past the exploration, and now it's figuring out what is going to be my strategy, my approach to doing this. It's another form of market analysis, and it will be covered next week in next week's session on where are the big opportunities in healthcare. So tune in next week when we have a guest panel that includes a bunch of very interesting and exciting experts on big opportunities in healthcare. We have Molly Shoyhead, who just I read the other day, she got some new grant of several millions with Shauna Kelly. So she's likely, unless she is coming. We have Mohammed Mandami, who is in charge, who when I first got to know him, he was running the UHN design support that helped researchers develop their design protocols for testing new innovations. Now he works with AI and clinical applications of AI. And there are a few others I forget off the top of my head, but join us next week. And finally, Ideation Clinic. Thank you to Praxis, our sponsor. Thank you to Medventions and Innovate and Sunnybrook and all of you who show up. And I hope that it gives you an overview. To be absolutely honest, this is meaningless unless you actually sit down and try it and work with people and talk to people, and it's not an hour endeavor to come up with a good product and product plan.
Hello, I want to ask a question.
Sure.
So, like, I enjoyed the talk a lot, and I just want to ask if, like, in a midway, like, regulation change or the circumstances change, like the idea I found, I think it's in need in the beginning, but in the middle part, it's not that important. Then, like, what should the group do?
So the subtle way that people talk about it is called pivot. The more direct way is find something else. You have part of the cycle that we talk about is, and sorry, I'm going back to the ideation key, and it may not have these lines here, but it is an iterative. The reason the first part is a circle and the other part has arrows is because as you keep going through this, you learn new information. The more information and the better understanding you have up front, the more likely you are to succeed. The second a piece of information changes, one of your assumptions changes, the regulations change, you have to reevaluate. You have to re-verify that the need still exists and validate that your approach is still possible and meaningful. And if the answer to those questions is no, you had better fail fast and stop investing time and money into something that now will not likely work. If the answer is yes, then the question is, how do you pivot and adjust your approach to address this new barrier or this new opportunity? Does that make sense?
Yes.
You know, the people on like those shows, the Shark Tank, and that go out and they come out, or they used to come out, I don't know if it's still on anymore, and say, I am so convinced this is going to be $1 billion idea. I know this, I know this, I know this. I've spent my life savings doing this. And they've been at it 5 years and haven't sold anything. At some point, they have ignored some piece of information that could have killed that business before they spent 5 years and all of their savings. It's better to stop if you think there's no way for you to succeed, and try something else. Your fundamental assumptions have been questioned and changed. If you don't, then you are not necessarily likely to deliver to the market what the market is willing to pay for.
Joseph, we've got a question from Miriam. So for ideation context for praxis, we've moved. How do you go need finding if you can't rely on literature? How do you find and interview clinicians and affected patients? Very good question, Miriam.
So that is one of the first and great challenges, because if you don't have access to the people you are selling to, you need to find a way to access them, or you need to find something else to sell to. And this is the issue that we talked about earlier. If you don't have access to the patients you're trying to develop something for, that is going to limit your ability to actually develop something meaningful for them.
Yeah.
So either you partner, you find clinicians that have those patients, you find other companies or other people, or you have to have someone on your team that then is able. There are also ways to surrogate some of the experiences, but only to a certain extent. At the end of the day, there's a reason why we do clinical trials for approvals, because they actually want patients and people to give you that feedback. If you can't access your customer, how will you sell to them?
Okay, next question. What are the advantages or disadvantages of performing market analysis earlier in the needs analysis pipeline? Even if the market analysis is done later, the very nature of the idea is creating a filter at the onset, even without a specific solution in mind. Provided that any red flags are detected before any major commitments, is there any real difference in doing needs identification based on market analysis compared to doing it later on?
Okay, who can answer that? Anyone? What are you doing a market analysis on if you don't know what your intervention is? So let's go back to the communication example. If my product or what I want to solve is communication, and I start doing market analysis, and I'm going to see that there are apps, there are CRMs, there are ways of doing this, then I've already committed to either copying someone else's solution or possibly innovating it slightly incrementally. You've committed yourself to thinking about the problem in a particular way. And it's you thinking about the problem, not hearing what other people, the people that are going to use it, want. So, I mean, there's nothing wrong with doing a market analysis up front, but what are you analyzing? As they said, and it's not just me, most innovations, it's about thinking differently and seeing opportunities that other people don't see. So doing a market analysis, and I've had this for years, debates on this point, is that if you're doing a market analysis, you had better at that point already know a direction where you're going and already have a concept that you're trying to analyze. Otherwise, what are you doing a market analysis on? There's a big difference between an app that works on a phone versus an app that lives in the cloud versus a file folder that actually someone moves around. Until you know what you want to try and innovate, how do you do the market analysis around it? Atia, your hand is up, so answer me, challenge the opposite.
Okay. So Joseph, actually, what I was going to say is I think it would be really helpful on this if, you know, in the ideation key, Joseph, that push-pull, those arrows I keep fighting you on, I think I think that would address some of that. So there is no harm in, and of course I'm industry, so I'm going to just state my bias up front. There is no harm by a need being identified or being pushed or driven by the market. There's a difference between that and a market analysis. So Joseph, do you want to talk a little bit about the arrows, the push-pull? I think that's really important. I think Jigar, I think that will answer your question.
Okay, so I mean, this is getting much deeper into this, and this is why context is everything. The previous step in sort of identifying the purpose and the sort of gaps and opportunities are precisely speaking to that. There are different ways of innovating. There's what's called a market pull versus a push. So I think there was a slide in the earlier talk that alluded to this. A pull is when there's a definite gap in the market where there's an opportunity that either someone hasn't thought of or there's a real need. People are just, so for example, the poll right now, masks. There is a pull, there is a consumer need for face masks that did not exist 2 years ago. So the pull, which is now more or less saturated, I would argue, and not much of an opportunity, but about 2 years ago, there was a definite need for someone to produce quickly and effectively face coverings and masks. So that was a market pull. Versus someone has innovated a new way of creating a filter that will allow you to put smaller filters in cars. The market may not know it needs that, but the developer, the innovator, understands that they have an advantage because whatever they're doing is better or cheaper or whatever. And so they will need to push it out onto the market, which means convincing people that it's needed, marketing the opportunity, marketing different way of thinking about a problem. So based on sort of your position and thinking about where your idea, your end point, it will influence how you decide to get there. Does that answer the question? Ish. So again, like if you are doing a completely novel thing, then the iPod, the Apple iPod, Steve Jobs, when he launched it, could have done all the market analysis that he wanted to, but there was no real market for it because there was no real, it was a disruptive innovation.
Right.
But there was a need. There was a very, very big need. The need was, how do you compensate artists for digital distribution?
Great.
All right, we've gone over time. Apologies. We're just stop this. Thank you. I look forward to chatting with you again soon. Please come out next week. Please remember the Ideation Clinic is gearing up towards the challenge. So check it out, register. If you're interested in these topics, we're going to sort of lead you through idea, concept, prototype formation, and there is some funding in certain areas. So in addition to meeting some great people and learning how to do some of these things, there could be fellowships and little bits of support and fun and exciting mentors. So check it out and come out next time. Ahmed, back to you.
Yeah, thank you very much, Joseph. Such a great talk and a brain-teasing session. A lot of us, I think, will be leaving today with many valuable takeaways from things you presented. And I personally enjoyed the entire session. And I think a few key points that you talked about specifically that I think will be resonating, with many of our audience when you talked about carefully understanding or defining a need, but also examining your assumptions about a problem. Also, when you talked about understanding the bigger picture, figuring out your end game, the context and the pathway, and realizing that the need is just the beginning of this very challenging but rewarding journey. And getting allies and resources and going beyond the literature, speaking directly with the people with lived experience and relying more heavily on direct observations. And finally, your understanding that needs validation is a very iterative and cyclical in nature, and you have to keep going back and forth, and give it more time before you kind of rush towards ideation. Again, just a few points. You mentioned way more than this and very valuable, but those are the ones that kind of are stuck in my head right now. But thanks again for such a great presentation, and thanks for our attendees for joining us tonight. Again, as Joseph mentioned, our next session is scheduled for next Tuesday, January 25th from 4:30 until 7:30, and we'll be talking about bigger growth opportunities in healthcare, including AI in medicine, medical imaging, tissue and cell engineering, and digital therapeutics. So a session you don't want to miss. So please register either through the Sunnybrook Medventions page or through the Ideation Clinic website. And yeah, thank you again, and we hope to see you next week. Have a good night.